Hello, my name is Jakob, and I'm the corresponding author of this paper called Positive Predictive Values of Familial Hypercholesterolemia Diagnoses in the Danish National Patient Registry and the Danish Familial Hypercholesterolemia Registry, a validation study. And that's what it's about. It's about the validity of data. And it's a collaborative study between all the Danish lipid clinics. So there's a lot of people who have assisted in conducting this study and a lot of organizations. So thanks to all who have assisted. And it's about validity because in Denmark we have a lot of good registries where we can conduct a lot of good research. However, the validity of this research depends on the validity of data entered in these registries. So we have evaluated the validity of familial hypercholesterolemia diagnosis in 2 Danish registries because that hasn't been done before. The DNPR, Danish National Patient Registry, contains approximately 10,000 FH diagnoses when we conducted the study. And we validated a random sample covering the whole country of 800, thus 8% of all diagnoses. And 160 of these 800 had a heterozygous FH diagnosis. And we evaluated by a medical record audit, and we considered a diagnosis to be valid if we could identify a Dutch lipid clinical network score of 6 point or above, or a likely pathogenic or pathogenic FH genetic variant. We also validated the subset also registered in the Danish Familial Hypercholesterolemia Registry, which is a relatively new registry. And that was 473, where 383 were defined as FH cases because they had a DLCN score of 6 point or above entered in the DFH, and 166 were registered with a genetic variant in the DFH. The validity of any FH diagnosis in the DNPR was 64%. So 2 out of 3 being valid, that's not very high. 510 out of 800 with corresponding Wilson's confidence interval. So if we restrict it to those registered with an FH diagnosis at a department of cardiology as a primary diagnosis, the validity increased to 71%. And if it was a first-time heterozygous FH diagnosis in the DNPR, the validity increased to 88%, with 141 out of 160 being valid. If we looked at those registered in the DFH with a DLCN score of 6 point or above in the DFH, the validity was 83%, again with corresponding Wilson's confidence intervals. So when you conduct registry research, you have to ensure that your data is valid for both the research, but also for quality monitoring regarding familial hypercholesterolemia diagnosis. Thank you very much. We hope you enjoy our paper, and we hope that you respect the validity of data.